if I had to pick a single thing that I feel like we could do with more legal, ethical, and even medical education about, it would be the concept of capacity, and particularly for those of us who deal with patients at the end of their lives. I learned this myself when I met Jack, who was 95 when I first met him. He was admitted to ICU because of self-neglect at home. He hadn't been eating, drinking, and looking after himself, and was so ill that he had to come to ICU, but he did survive that. And he said, all I want to do is go home on my own, 95. I know I've been neglectful in the past, but I just want to go home. And we wondered whether he had the capacity to make that decision. There were medical decisions that had to be made that we had to gain his consent for. So a number of people saw him, but in the end, we had an occupational therapist who administered the Montreal assessment, but he was determined to go home, and go home he did, with a very stout advanced care directive saying that he never wanted any kind of resuscitation in the event that he represented, which we knew he would. And indeed he did, actually. So he came back in. We did the minimum to keep him going. And although he'd refused resuscitation, he was happy for us to give him some vitamins. He was very malnourished. Potassium to keep his heart going. So there were a few things that he was prepared to let us do. So we negotiated our way through. I mean, once you realize you're dealing with a person with capacity, you understand that the point is you negotiate. And this is what we did. We had to negotiate everything with him. Will he have this? Will he not have that? And we picked our way through it. We managed to persuade him to go to residential aged care, but he refused to eat and drink anything when he was there and died in about 3 weeks. But what was interesting in the case from my point of view was that everybody challenged his capacity constantly, because nobody liked him, actually. I did, but a lot of people didn't. But he was also quite hard to look after. He was garrulous, he was difficult, he was a bit irrational, but he did have capacity. And therefore he was in charge of what happened to himself. And while that wouldn't have been what you might have wished, it's what he wanted, and he had the capacity to do that. From a legal viewpoint, an ethical viewpoint, you don't have to be a good boy or like rational to have capacity. So although everything he said we disagreed with, and everything he wanted we didn't want him to have, we couldn't really say he didn't have capacity. It would have been bad for us to pretend he didn't have capacity because we didn't agree with him. It's very important that we don't think people lack capacity just because they want something that we don't want, which is the lesson that I learned from Jack. So I think that, the take homes for me from all of that were, capacity is a key issue at end of life. That's where capacity becomes most fragile and commonly absent. The important thing for us to understand was that although we had these tests that showed that his mind worked, that in the end there is a legal requirement for capacity, which he has to understand the nature and effect of what he's agreeing to, and he has to be able to apply that to himself, and not just understand that in an arbitrary sense, but actually realize we do intend that would happen to him. I think that one of the things for clinicians to understand is that you can't outsource this idea of capacity to somebody else to test, because in the end, you're legally and ethically accountable